The United States has fully vaccinated more than 150 million people against the coronavirus, marking a major milestone in the fight against COVID-19. So does that mean we're getting closer to the end of this pandemic? Here's what Topline MD's affiliated infectious disease specialist, Dr. Andrew Martin, has to say.
Things have definitely improved on the COVID front, at least in South Florida, but we're certainly not out of the woods yet. The caseload in South Florida has significantly decreased over the past several weeks to now going on months, thanks to vaccination. However, there are other states that, as of recently, are having a slight uptick in cases, likely because their vaccination rate has been a little bit lower than ours. Because there has been at least 67% of the population with at least one dose of the vaccine, that has certainly improved the number of cases that we're seeing on a day-to-day basis. And in fact, the hospitalization rate in general has decreased significantly. Thankfully, a lot of things are going back to normal, but there are still enough cases around us where we cannot put our guard down just yet. And unfortunately, the vaccination rate has plateaued, so that's really not helping the amount of cases that we have.
And with this continued increase in cases, are they as worrisome as they were a few months ago? Or has the virus become not as infectious or severe in these new cases?
Based on CDC guidance and on CDC's numbers, that the Delta variant has definitely increased in number as far as the causative strain for cases of COVID-19, and currently is the second most common strain to cause COVID in the United States. Of all COVID cases, approximately 37 to 40% of them are caused by the Delta variant. So that's a pretty high number.
We have seen other contagious strands of COVID-19 throughout this pandemic. Why is the Delta variant so concerning?
So the issue with the Delta variant is that we see that it is affecting a younger population that maybe does not have all of the risk factors that we were seeing early on with the initial strains of COVID that we believe came out of Wuhan. We are seeing cases not only in younger patients, but the cases are transmissible at a higher rate and are more severe. So unfortunately, we are seeing that some of our younger patients who have no comorbidities end up in the hospital with severe disease. So why is that important? Well, if it's more transmissible and a lot more virulent or a lot more aggressive, well, we're going to see more severe cases.
So is there anything we can do to make sure this doesn't cause another huge dangerous spike and make us regress?
The answer actually is vaccination. We have in vitro data that shows that Pfizer, Moderna, and Johnson & Johnson vaccines all have some immune effect against the variant. It is not as good as with the initial strain, but it is good enough, whereas if we have enough patients or enough of the population vaccinated, we should be able to curb this rate of transmission with the variant.
Dr. Martin, even with all of this valuable information and data that we have now, we're still seeing, like you mentioned, a vaccination plateau. Why do you think that's happening right now?
I think there's lots of factors. I think the biggest is fear, but most of the fear, in my opinion, is based on just lack of information. Fortunately, we live in an era of social media, of the internet, which can be good and bad, full of opinions without facts or without scientific knowledge behind these opinions. And people are fearful because they don't understand the process of how the vaccine came about so quickly. They hear potential side effects from the vaccines, which are present in any medication that we've produced. It has a potential side effect. They don't realize that these side effects are a lot less likely to happen and less morbid, or have a lower mortality than COVID itself. So I think that fear is the biggest factor. I think that there is another subgroup of patients in the younger population who, have felt kind of immune to the virus, if you will, because they, in general, they know that if they get the virus, the likelihood of them having a severe case is pretty low, or of them having any symptoms is low, and therefore have not wanted to get vaccinated for that reason. And up until recently, really, we had a subgroup of young patients who could not get vaccinated because there was no indication. That has changed, thankfully. But the Delta variant should cause some pause and rethinking of that mentality, because now we're seeing younger patients get infected and younger patients get very ill. So I'm hoping that with that new information of knowing that the vaccine does work against the variant and that it will help protect the younger population from getting severe disease, that we'll see an increase in vaccination rates.
And in helping do that, Topline MD affiliated providers in various specialties are answering common questions and concerns about these vaccines. You can learn more by visiting the COVID-19 resource page and newsroom on toplinemd.com.